Great. Yeah, I got to follow that speech. Thanks so much. So thanks, everyone. And before I say anything else, one, thanks so much to the CNA for sponsoring this event. And a special thank you to Congressman Conyers for having the fortitude and the foresight to author this bill. So why is the International Federation of Professional Technical Engineers, it's like 17 syllables, why are we so interested in this? Why am I, the president of this organization, so interested in chairing this caucus and sponsoring this bill? I'll tell you, there's a couple of reasons. One, my family. This is important. My daughter is a registered nurse at Milwaukee Children's Hospital. My daughter-in-law is a registered nurse at Good Samaritan Hospital in Milwaukee County. I hear from them the same sort of stories, that we have to deny patients. We have to deny patients the needed care. Secondly, in terms of my family, as the doctor just pointed out, I tell you, I got a son who was in the Marine Corps for 9 years, 3 tours in Iraq and a stint in Afghanistan. And when he got out of the Marine Corps, his first concern was, how am I going to pay for my own medical insurance? I can go for the GI Bill, I can get help through that, you know, I can go and get a job doing something. How am I going to provide for my own medical care? So I do it for him. My union is part of a strategic alliance with the CWA, the UAW, and the steelworkers toward 4 essential goals that we think are important for our union: the pension protection, jobs and trade, the Employee Free Choice Act, that patches the Employee Free Choice Act, and last but not least, health care for all. This is important to our coalition, to our alliance. And of course, my union has endorsed H.R. 676, as have, and these are some good numbers, 455 local and national unions in the United States have endorsed H.R. 676. 112 central labor councils have endorsed H.R. 676. 37 state labor federations have endorsed H.R. 676. And you know what we did to make that happen? Nothing. We didn't lift a finger. They did it on their own, because these people all across this country got together and said, we got to do something different. Here in Colorado, the Colorado State Building Trades recently endorsed H.R. 676, single-payer Medi-Cal for all, and in their statement they said the reason is because in the last 10 years they don't think that their members have even gotten a raise that keeps current with inflation, that any penny that they've got from their employer in terms of wage increases has gone to offset the increases in their own medical care. See, when we're at the bargaining table, I mean, I'm old enough now that I remember when I used to actually bargain for medical care. When we would say to an employer, we want such and such more for vision, we want such and such more outlay for hospital care, we want this for dental. We don't do that anymore. Now what we do is we bargain over who's going to pay what for insurance. We don't bargain for medical care, we bargain over insurance. Over insurance, and what the hell is that? So you know what we do is every 3 years, we get together, and this is what I think it is. We're not curing the problem. We're not even addressing the problem. It's like spraying room freshener around the room, and you don't get to the source of the stink. And then 3 years later, suddenly the room freshener is dissipated, and it starts to smell like hell again. And you got to do it all over again, and our members continue to lose. So we got to have something. We can't solve this at the bargaining table. And more employers are getting out of this business. We see the statistics out of the Department of Labor. Employer-provided health insurance now is below 54%. It was at 60 at the start of this decade, and every year it gets lower and lower. And the employers that I've got to deal with are very interested in market-based pay and market-based benefits. If I'm dealing with an employer here that isn't providing medical benefits, I'm going to have a hell of a time getting it from their competitor over there. So we can't solve this at the bargaining table. It has to be done legislatively. You know, I'll tell you, when back in 2000, when they were going through the debates on the Republican side, and it was George W. and McCain and Alan Keyes and that goofy little radio guy, you know, and I remember one of the questions was, who is the philosopher that has changed your life? And George W. Bush said, well, for me, it was Jesus Christ. And I thought, well, that's kind of a stupid answer because he's not really a philosopher. But, you know, maybe it tells you something about him. Because, now the reason I bring that up is this. As was pointed out, we have about 45 to 47 million people in this country without health insurance. Another 45 million that are underinsured. Who are these people? Who are these people? My members all have health insurance, every one of them. Who are these people that don't have it? They're the unemployed. They're single mothers. They're single parents. They're kids getting out of school. They're people leaving the service. They're people entering the job market for the first time. These are sort of the forgotten of our society, aren't they? So you would think that somebody who says, geez, I believe in the teachings of Jesus Christ, would care about that. Because, you know, maybe when George Bush, maybe when George Bush was considering that answer, I don't know if he's read the whole Bible. I mean, it's a little longer and a little more complex than My Pet Goat. Maybe he hasn't gotten through the whole thing. But you think about this and think about this next week when these right-wing Christian conservative people who are going to lord over us with their religious beliefs, what do they think about single payer? What do they think about universal health care for all? I'll tell you what the Bible says. In the Sermon on the Mount, and I don't know if George Bush ever got to this, in Matthew chapter 25, verse 45 says, as ye fail to do to the least of mine, ye fail to do to me. You remember that, Matthew 25:45. Matthew 25:45. And you know what else George Bush should read? Matthew 25:46 says, and if you do not, you will face eternal damnation. So, I don't know if he's right about that, but if there's a God, there's a devil, and if there's a heaven, there's a hell, and if there's a hell, that's where that son of a bitch is going. So as we move forward on this, we're going to get Obama and Biden elected. We're going to get this passed. We're going to get this passed as soon as he becomes president. I know John Conyers is going to keep building on the co-sponsors in the House and in the Senate. We're going to get this passed into law next year. And I know you're going to work like heck. You're going to get Senator Biden elected as president. I'm going to be there working with you. Together, through this convention, from today through November 4th, we're going to make history. From November 4th until Inauguration Day, we're going to continue to work. And when we take control of Washington, D.C., we're going to pass H.R. 676, Medicare for all, and restore justice to this country. Thank you.